I can't imagine what procedure would do such a thing. But there's like a wire there. I don't know what that is.
Maybe it's a toy.
It swallowed something. The cat swallowed something.
That's how it died.
You can see it shudder.
I don't know. Jeez.
This is pretty hardcore.
Wait a second.
There's something.
There's something weird here. It's like there's a little metal. What's that? A force hemostat?
Oh, are you kidding?
I don't know what I'm gonna do.
What is
The
it?
cat swallowed something.
Oh, that sucks.
It's fur.
Yeah.
Oh no, I think I saw you before though. I mean,
There is something sharp there though. I don't think that's
It's
the
not a
hyoid.
bone.
Maybe it's the hyoid.
That high?
Okay, but here I can make out the.
The trachea.
So here's the trachea along here, and here you can see the larynx.
Mm-hmm.
And then I want you. You got your. Who has gloves?
Trachea cartilage. You can see
Okay.
it.
Now right about where my finger is, I want you to go like that. So like right between my fingers, aggressively, big cut.
Is it tough?
Okay. Let's see. What I want to try to do is get above the larynx.
I'll see you later.
I know, but I can't.
I hope so.
I think that bone is getting me.
I mean, the question.
That's alright. You should get one of those like pole thing, connect to the phone. Just like put it on.
It's usually not this hard to do.
Some stuff.
No.
Okay, so I did a tracheectomy. And you can see over here, what I'm going to do is take this, and you see the little flap there?
Uh-huh.
That's the epiglottis. We can clean it up a little bit, but there's the epiglottis right there. And you can see in there, if I take, do we have a probe? Yeah. So I'm going to take this probe and stick it through that little opening, and I should be in the,
Trachea.
see, I'm in the trachea.
Uh-huh.
But now if I go behind this, it's muscular, and now I'm in the esophagus. You see how it's in a different place? So now I'm in the esophagus,
Yeah.
and if I go forward, up underneath the epiglottis,
Sorry.
here's the trachea. So I can see the larynx with the epiglottis, and I can see the trachea. And if you run your finger along there, can you feel the ribs?
Yeah.
You can feel the ribs there, so it has these cartilage rings that make up the trachea that keep its shape so that it doesn't collapse so you can breathe. But what's nice, while everyone's here with all their video equipment,
You're gonna do this
there's the heart.
so we can see.
Yeah, why don't you come over and take a quick look, and I'll just do this again and maybe one more time. There's the heart, and here's the lungs. Here, go ahead and push, just push your way in. And then here's the right, I'm sorry, the left
Atrium.
atrium, and then over here is the right atrium. Here's the ventricles, and I can't quite make out where the dividing is, but right here, this vessel that I'm kind of poking right now, that's the pulmonary trunk, and that's going up. And it's not as strong as the aorta. And the aorta is coming off somewhere in here and looping around. So here's the aortic arch, is where my probe is touching. Coming off the aortic arch, I only see 2 branches, which is normal for a cat. I can see this big branch here, brachiocephalic, right along where my probe is going, and then it splits into 3. Right subclavian, right common carotid, left common carotid, and this other branch, which is coming off the aortic arch, is the left subclavian. Right there, I'm kind of pulling up, and I believe that's the vagus nerve. So, you
So
can see,
where would be the white subclavian coming from? There's not in there.
the right subclavian is right here,
What's in that?
is this one. It's one of the branches of.
Coming out from
the
there.
Right, so
Okay.
it's different,
right,
so
yeah.
what's different between us and a cat, this left common carotid on us comes off the arch, but on the cat, it comes off the brachiocephalic. Okay, now, while we got this all set up,
Okay.
I'm gonna explore a little bit. Oh, what's this?
Explain.
Spleen. And here's the greater omentum.
Why is his spleen so big?
That's a cat. I'm not, I think it's normal.
Oh, interesting. Because our spleen's not,
No.
Gerda's not that.
But some people have splenomegaly for different reasons. But here's the greater omentum, and it just sits right on top. It's like an apron over the intestines. Here we can see the liver. Big liver. Oh, and look at that. What's that green thing?
Ew.
The gallbladder.
The gallbladder's in between?
Yeah, it's just kind of stuck in there. Oh, and here's the stomach. Right there, and let's see. Little
should have said this in
friskies.
the
You can
okay,
feel
right.
little friskies. If you want to, at some point, you can open up the stomach and we'll see what's in there. But we don't have to do that right now.
Okay.
I don't really want to either. Here's the small intestines, and look at the nice mesentery. Doesn't that look like a flower?
I guess.
What's that thing embedded in fat there?
Kidneys.
There's a kidney right there. So this cat probably ate pretty well. Okay, let's see.
I figured the Hurricane Katrina kitty.
Probably not the best thing to
So if that's a
videotape.
kidney, then what's that big white stuff there?
That's just fat.
That's fat?
Adip- the capsule, the fatty capsule around it. Okay, I'm gonna not poke myself. Here I can see some blood vessels. So the diaphragm, let's see, here's the diaphragm right here. Okay, so I'm grabbing it, this muscle right here. Okay, that's the diaphragm. But as I get through the diaphragm, up in here, I'm gonna start seeing, you see that red vessel right in there?
Uh-huh.
That's either gonna be the celiac trunk or the superior mesenteric. So what I'm gonna have to do is kind of follow through here and see where I am. So you can start to see it. Now if this one splits into 3, then I know I have the celiac trunk. But I think that's what it is. What's first, celiac trunk or superior mesenteric?
Celiac trunk.
It's superior to.
Then there's-
So this must be the superior mesenteric, I'm guessing. You see that right there? And then if I go up a little higher, I might be able to find the celiac trunk, unless I'm wrong. And I didn't want to use anything that's too sharp. I'm just using a probe and kind of breaking up connective tissue. And I should let you do this because it's the experience that I'm looking for. Okay, and then I'm going to cut through all this stuff and head down here. Now, if we look carefully, we might be able to find the renals. So that's
break them
the,
out of the capsule.
there's the kidney, and if I kind of clean it up a little bit,
It's a bad kidney.
and I'm not doing a great job, this is kind of a fat
Oh, there
cat.
it is.
But you can see the renal vein, and there I'm starting to see the renal artery going in there. It takes a little cleaning up, probably not the best point to be videotaping because it's not yet done. And then right here I can feel something that's kind of, look at that. What do you think that thing
Has to
is?
go to the gonad?
No.
No?
Ureter.
Ureter.
Ureter?
Ureter, it's heading down to the bladder right there, or right
Oh,
here.
the kidney.
And then if we clean up the descending aorta, not only will we find superior mesenteric celiac trunk up here, but we might be able to find, if you're really careful, unlike me, we can find the gonadal. Is this a male or a female?
This is, I don't see that. I have to glove.
I think I think it was female.
Is it a female? I don't see that.
Yeah, he was a female.
Is it ovary? No, it's too low. It's low for lower. That is.
Is that his bladder that you're moving?
This is the bladder.
Okay.
Okay.
You sure it's a
It
female?
may be, no, maybe, I can't
It's a
tell. Maybe it's male.
male.
It's a male,
So I
yeah.
think this is like
Yeah, he's a male.
seminal vesicles,
Okay.
and then prostate would be down below.
So his vesicles sit up higher?
Kind of to the sides there. But let's see, I'm looking for, look, I think I found something. Right here, see that little artery along there? I bet that's the gonadal, and if we follow it up, I bet it goes to the aorta. You see how it's going up? And it's a little skinny one. There it is. So I could stick a pin in that and show you that. Gonadal. And if we
Okay.
go further down,
So where the middle inferior mesenteric artery?
yeah, we'll have to clean it up a little bit.
It's another red one.
I
there.
should wear
It's
that.
another one red one.
Okay, now, there it is. Okay, so you can probably see over my left shoulder, right here.
Oh, yeah.
You see that little, like a chevron pattern? Right there. So here's the end of the aorta. I found it. And then here, I can see that little pattern there. So these top two branches are the left and right external iliac, and the bottom two branches are the internal iliac, and it's just
Okay.
not really clear, but I'm starting to get it cleaned up. And it looks like I'm finding the aorta, and probably what I should do, is what I am doing, is just clean it all the way up, and you can find those branches. So that was a really quick overview, but you can spend a little time doing this yourselves, and then we'll use this kitty as well as one other kitty or two on the test. So I think I covered almost everything off the cat just there. So I'll stop and let you explain.